Weekly Checkup brought to you by Dignity Health Central Coast.
Cervical disc replacements are helping patients with damaged or degenerative discs retain their range of motion while relieving symptoms. Dr. Rocco Calderon at St. John's Hospitals explains.
Cervical disc replacement is a replacement to a damaged disc, and it is performed through the front of the neck through a small 1-inch incision where the herniated or damaged disc is removed and a mechanical disc is replaced into that spot. The disc replacements we're using today are significantly advanced. The benefits of cervical disc replacement is that it preserves the motion of the disc so that that segment of the neck still moves, and it prevents increased stress at a level above or below. It is thought to prevent further degeneration, which is an advantage over a cervical fusion. The surgery takes 1 to 2 hours, and patient goes home the same day or the following morning. And by 2 weeks or 3 weeks, they're doing fairly well. So the recovery time on a disc replacement is quicker than the recovery time on a cervical fusion.
For more information, visit dignityhealth.org/Central Coast. I'm Beverly Herbert.
Weekly Checkup brought to you by Dignity Health Central Coast.